You will find that CHAC within her strategic priorities, we have positioned CHAC within, diabetes within very high levels, especially with regard to management of diabetes in pregnancy. 3.5% of all Kenyans have got diabetes. And nationally, about 3.5% are just at the verge of getting diabetes, what we call pre-diabetes. Of course, there are quite a number of things that do put people at risk of getting diabetes. One is age. If you are above 40 years, you are likely to get diabetes. And as you grow older, the chances become more. So you need to be screened regularly, literally speaking, on an annual basis.
We are celebrating World Diabetes Day with a theme of today of enhancing access to diabetes care. We are celebrating with our patients, the communities of Naivasha, with our partners, the government, and CHAC, and ourselves. Diabetes is on the rise in Kenya, but it is also on the rise in our facility. Our diabetes numbers have increased drastically. We have about 50% of our patients who are coming for a totally different reason, who are actually found to have diabetes when they are screened. Unfortunately, as it is in most of African countries, because of the lack of awareness of just a cultural behavior, we don't go to hospital until it is too late. So most of our patients that we have, they come when they are already at the point of complications, which makes healthcare more expensive because screening is way cheaper than dealing with complications of diabetes. We are talking about patients who are on dialysis because they are diabetic, patients who are having amputations because they have uncontrolled diabetes, the complications like those ones. Usually diabetes is silent. It doesn't have any symptoms. When it starts having symptoms, it means it has actually gone a bit far. And when there are no control, when your patient is not on medication and they continue with the lifestyle that brought the diabetes in the first place, then it is possible by from the time of contracting diabetes and maybe like 8 years up to 10 years from the time of diagnosis, if nothing is done, it's possible to die from complications. Most of them it's kidney complications, some of them it's limb complications, and others it's other associated comorbidities. Hypertension will come in, high cholesterol levels will come in, and when they come together, you will have more people who have stroke, more people who have heart attack because of uncontrolled diabetes. During pregnancy, it's actually another risk of developing diabetes, even if you didn't have diabetes in the past. And you can tell even young women who usually in the general population, we say the risk factor age related is above 40. But even below 40, women who are pregnant can develop diabetes. When diabetes is not diagnosed and treated during pregnancy, there is a risk of having a big baby, and delivery will be a problem because of the size of the baby. that can bring the complication for the baby. And number 2 is the risk of actually losing the baby inside the mother's womb because of high sugar levels in the system of the baby. The other thing is the mother who has had diabetes during pregnancy, usually about 3 months after delivery, we follow them up. After 3 months after delivery, usually the sugars will go back to normal, but they are at higher risk of developing type 2 diabetes now because of the history of having diabetes in pregnancy. In general, it is known that most of the diabetic people are women, mostly. However, in our facility, it's equal numbers, but we don't have enough numbers to actually decide and tell. I think it is a bit too early to say, but in general, it's more in women. Yes. So we are very, very grateful for what the government is already doing in terms of having insisting on non-communicable diseases as a package on its own. And what we will request is empowering more our community health promoters to do the work in the community that the doctors is not able to do in the hospital, because you can imagine having the community, like this whole community that is here in Kigoto community, to bring them to hospital is usually not very feasible. Even if you educate them, sometimes it takes long for patients to uptake that. However, when you empower the community health promoters with knowledge, with skills to screen, with knowledge to detect complication before it's too late, with knowledge to empower patients who are already diabetic to follow up in the hospital, to follow up with their healthcare facilities, empowering the community aspect of diabetic prevention and care is what will really make a big change. Because as I can tell you, it will take time to change culture. It will take time to convince Kenyans that you can go to hospital even if you are not feeling sick. It will take time. But in the meantime, I think empowering the community health promoters will bring a change.